So, like we're saying, the situation we have in Nigeria right now, according to a study that was done by Carey et al. 2015, in their population-based study where they analyze the type of glaucoma and the prevalence of glaucoma in Nigeria, they found out some key interesting factor that we have a high prevalence of glaucoma in Nigeria, and is largely primary open angle glaucoma. That's the type that is highly prevalent. They also discovered that most people who are affected by glaucoma in Nigeria end up being blind. They also discovered that one of the causes of glaucoma, secondary glaucoma, is the consequences of cataract surgery. That's post-cataract surgery factor that caused the glaucoma. They also recommended that public health enlightenment could help in reducing the morbidity in glaucoma that is prevalent in Nigeria. So these were among the findings and some of the recommendations that their research in 2015 had to do, and it was done in partnership with the National Blindness Commission. So, having said that, we have to move on to what are the types of glaucoma that we have and what are the symptoms. The type we have primary open angle glaucoma, and we have acute angle closure glaucoma. When we may be hearing angle closure, primary open angle, it's because the glaucoma on its own is caused by, there is a fluid produced in the eye that flows out through a place called the filtration angle in the eye. Now, when this angle where this fluid produced flows out is either completely obstructed or it is partially obstructed, it reduces the flow of fluid out of the eye, and that will lead to the increase of a pressure in the eye called the intraocular pressure. When this intraocular pressure increases, it causes damage to the optic nerve, and that brings about the destruction of vision in glaucoma. So when we say open angle, we're talking about where this angle is open. There's nothing obstructing it, yet we have glaucoma, or yet the intraocular pressure is being increased in the destruction of the optic nerve. And where we have acute angle closure, those ones are emergency conditions where that angle is closed, and it brings about some known symptoms which will make the patient present to the hospital as an emergency, sometimes redness, vomiting, among other symptoms that it may present. So when we have primary open angle glaucoma, there is usually no symptoms. The only symptom that you find out is when there is gradual reduction of vision and the person finally goes blind. So the causes, we will not go into the causes of this glaucoma. These causes are not known, especially that of primary open angle glaucoma.